In the last few years, we've all heard the term public health a lot. But what you might not realize is that it operates on this really unique and powerful ethical framework. It's like a blueprint for how an entire society can stay healthy. So today, we're going to walk through that exact blueprint. Okay, so to really get this, we've got to start by making a super important distinction. When most of us think about health, we picture doctors, nurses, medicine. But public health, it's playing a totally different ballgame.
Think about it like this. Regular medicine, that's all about you, the individual, usually when you're already sick. The goal is to cure you. Public health, on the other hand, zooms way out. It looks at the whole community. And its main goal isn't to cure, but to stop people from ever getting sick in the first place. It's about what we do together as a group to make sure everyone has a shot at being healthy.
So if the goals are that different, it kind of makes sense that the rulebook would have to be different too, right? Why can't public health just borrow the ethics from medicine? Well, it's because the ethics of that one-on-one doctor-patient relationship, they just don't scale up. They don't really work when you're making decisions that affect millions of people. Public health has to think about everybody, including all the people who feel perfectly fine right now. And that creates a whole different set of ethical puzzles that need their own special code to solve.
And this quote right here, it just nails it. This is the heart of the whole thing. Public health sometimes needs to use its authority, its power, to protect the community's health. But at the exact same time, it has to be incredibly careful not to abuse that power. And navigating that tension, that is the absolute central challenge of public health ethics.
So how do you even begin to navigate that? Well, it all starts with a set of core beliefs. Think of these as the foundation that the entire ethical code is built on. And maybe the single most important belief is this one: interdependence. It's a really simple but incredibly powerful idea. We're all connected. My health is tied to your health, and both of our health is tied to the community we share. The source material for this calls it the very essence of community, and I think that's perfect. This idea of interdependence, it leads straight to these values. We're social animals. We depend on each other. And because of that, trust is everything. Without public trust, health initiatives just fall flat. It means collaboration is a must, not just between different agencies, but between people and the very environment they live in. Now, the other side of the coin connects what we know to what we do. The code says we have a responsibility to go out and get scientific knowledge. But that knowledge isn't meant to just sit on a shelf somewhere. It demands that we act. And here's the crucial part. Our actions aren't based on data alone. They're guided by our shared values, which help us decide what the right thing to do with that information is.
Okay, so we've got the big foundational beliefs. But how do you turn those into something a public health professional can actually use day to day? That's where the 12 ethical principles come in. This is the blueprint itself.
12 core principles that take all those values we just talked about and turn them into a clear guide for ethical work. Let's break them down into a few groups to make it easier to digest.
The first group was all about focus and empowerment. This means you don't just treat the symptoms, you go upstream and tackle the root causes of disease. But while you're doing that, you have to respect individual rights, make sure the community actually has a say in what's happening, and work to lift up the voices of those who are often ignored.
All right, the next set of principles deals with information and action. It creates this kind of cycle of responsibility. First, you get the information you need to make good decisions. Then, you share that information with the community and get their consent. Then you have to act. You can't just sit on it. And all the while, you've got to respect the different values and cultures that make up that community. And this last group is all about responsibility and trust. This is the nuts and bolts. Things like making the physical and social environment healthier, fiercely protecting people's private information, and making sure the people doing the work are actually competent. And all of this works toward one big goal: building public trust by working together transparently.
Now, I know what you might be thinking. This all sounds great, maybe a little academic, but how does it actually connect to the real world? How do these ideals really become reality?
Well, the link is actually incredibly direct. These 12 principles are not just some philosophical wish list. They are the direct foundation for the 10 essential public health services. That's the actual on-the-ground work that public health agencies are doing every single day. And you can see that connection so clearly right here. Take an essential service like inform, educate, and empower people. Where does that come from? It flows directly from ethical principle number 6, provide communities with information, or assure a competent workforce. That's principle 11. See? The ethics literally drive the action.
And this brings us right back where we started, to that core tension, that fundamental balancing act that's at the very heart of public health.
Because this ethical code, it doesn't give you easy black and white answers. What it does is provide a framework for navigating that constant, tricky tension between protecting the health of the community and respecting the rights of the individual. I mean, just think about any debate over things like mandatory vaccines or even seatbelt laws. That's the tension right there.
And here's the crucial takeaway. The code doesn't magically solve this tension. What it does is give a starting point. It says that while you have to weigh both sides, for public health, the well-being of the entire community, that's the starting place in the equation. That's where the ethical thinking begins. And so that leaves all of us with this huge essential question. It's a question this ethical code helps us think about, but it's one that every community, and really every single one of us, has to keep asking. Thanks for tuning in.